Do you know there are certain vitamins which also cause anemia? One of the vitamins causing anemia is folic acid. In 1920s, scientists thought that folic acid deficiency and anemia are the same conditions. But later in 1935, they have recognized that folic acid deficiency does not cause anemia in all but in pregnant women. And this anemia is reversed by giving brewer's yeast. They have extracted folic acid from the spinach leaf. The foliage means leaf. That is why the name folic. Half of the folic acid that is absorbed is stored in liver and it is excreted through bile and urine. Very important for rapidly dividing cells. Therefore, in folic acid deficiency, DNA and methylation will reduce. It is important for cell division, maturation of RBC, synthesis of nucleic acid and DNA, metabolism of amino acids, formation of neurotransmitters. So, supplementation with folic acid improves mental confusion, decreases homocysteine levels in blood, and therefore prevents the heart disease. Helps to maintain normal blood pressure and prevents the risk of cancer. Rich sources of folic acid are liver, then green leafy vegetables, legumes. Other sources are orange, cabbage, broccoli, cauliflower, wheat germ. 33% is lost during cooking and 50% is only absorbed. Based on this, 200 micrograms is recommended for adult and 500 micrograms for pregnant women and 300 micrograms for lactating women. Deficiency is caused because of increased requirement, inadequate absorption, and increased excretion of folic acid. Since there is decrease in DNA synthesis and RBC maturation, there is megaloblastic anemia that is formed. That means large cells are circulated in the blood, and this decreases the oxygen carrying capacity of the blood. As a result, anemia occurs. And since there are large size cells circulating in the gastrointestinal tract also, the absorption capacity is decreased. WBC synthesis also is lowered, therefore, it affects the immunity. There is inflammation of tongue and mouth, abnormal pigmentation on the skin, diarrhea, poor growth, depression, problems in nerve function, and homocysteine levels are elevated. The pregnant woman has deficiency of folic acid. There is neural tube defect. Generally, the neural tube closes within 28 days of pregnancy, and if it is not done, the spinal cord remains open at the back. So, this is fatal to the infant, does not survive for a longer period. That is why the folic acid supplementation should be given right from